Over 700,000 knee replacement surgeries are conducted in the U.S. each year. Research has shown that up to 22% of those surgeries result in no clinical improvement. That's nearly $4 billion of surgeries with no benefit, and yet few hospitals follow up to learn whether a surgery worked or use that data to improve. SIFT and the New England Baptist Hospital are turning data into better surgical care. Today, when a patient checks in for their surgical consult, they're handed an iPad. They answer 90 seconds worth of questions related to their health. This information is sent to SIFT's secure cloud, where a machine learning model returns back a personalized prediction. It shows the likelihood that the patient will be better, the same, or worse 12 months after knee replacement. The prediction becomes part of the consult, with the patient and their surgeon using it to make better informed decisions. We designed this system to be as simple and self-contained as possible. Fully loaded iPads for the clinics, a web-based administrative interface to view predictions and reports of outcomes, and we handle the follow-up with patients via text, email, and phone to learn their outcomes. The goal is to make it easy and affordable for every patient and surgeon to make better informed decisions. Better decisions equals better outcomes and fewer unnecessary surgeries. Surgeons can use their own outcomes data to improve. Hospitals and payers can use the data to design contracts based on value, not just volume. This idea of turning data into better surgeries isn't a new one. The first surgeon to argue that we capture the before and after data of every surgery was Dr. Ernest Codman in 1895. Dr. Codman is buried just a few miles from the Baptist. On his gravestone, he's quoted, "It may take 100 years for my ideas to be accepted." Now's the time to start turning data into better healthcare. If you'd like to learn more, send us a note at info@sift.com.